I'm really happy and gratified to be here today on the occasion of the Governor's signing into law of House Bill 2744, requiring extension of basic health insurance coverage for autism spectrum disorder to a number of families who have children with autism in the state of Kansas. Today, long in the making, a lot of hard work went into this by a lot of people, not the least of which is the gentleman to my right, Representative Mike Kiegerl. He and former Representative Arlen Siegfried and I have been fighting this fight for a number of years, and we've finally accomplished results. We haven't accomplished yet everything we want, but we've made good headway. About 750 kids in the next 2 years will be covered under basic health insurance coverage for autism spectrum disorder.
First of all, I appreciate Governor Brownback, his support and his help in this matter. But there are also two others that need to be mentioned. Obviously, John Rubin carried the heavy load in my absence, and he's more responsible than anybody for this bill coming to the floor. Arlen Siegfried, the former majority leader, also 2 years ago helped pass a bill which actually was a slightly better bill than this one, but he deserves also some credit. And I want to tell you a bit about autism, which is non-curable but treatable. Imagine a little 3-year-old on the floor in a fetal position and wearing a helmet because he hits his head on the floor and on the wall and he hurts himself. He's incommunicative, he doesn't speak. When you touch him, he screams. What a heartache for the parents. Now fast forward 4 years, the same little boy is in grade school. He's doing very well. His IQ is actually above average, and he's a whiz in math and with numbers. What happened? Well, what happened was that he had a wealthy grandma who spent much of her fortune giving him the intervention these kids need. And he is going to become a citizen who is going to contribute to society rather than a burden. And think of another child, another grandma who came to me 10 years ago in my freshman year in the house. And she had a 13-year-old grandson that she was raising who was severely autistic. He went with his head through the windshield of the car, and they couldn't handle him anymore. He was 6 foot tall. And he is now at KNI in Topeka, where his monthly care is $18,000, $18,000 a month. And if his life expectancy is 80 some years, you can do the math on how much this is going to cost society. It is economically foolish for us not to pass this legislation. It's penny wise, pound foolish. We not only save a lot of money, but we also save human beings. The psychologist who showed us that little 3-year-old I mentioned told us that 50% of these kids could go to school, not in special ed, but in regular school, and 25% could improve enough to go to special ed. Sadly, the other 25% will have to be institutionalized. And I'm not saying that the young man at KNI could have been salvaged, but he might have been. We don't know. Simply, he did not get the care. It was not available, and it was not affordable.
This bill is as important as it is a good start. We were not able in this bill, because of limitations actually imposed by the Affordable Care Act, we were not able in this legislation to extend basic health insurance coverage for autism to all Kansas families who have kids with autism, because it would, under the Affordable Care Act, it would have cost the state a large amount of money. There would have been a huge fiscal note involved, and that would have made it politically impossible to pass. But the start here is we have now extended coverage to about 250 Kansas autistic children. As of next January, that number will go up to about 750 the year after next. These are children whose families are insured under large employer group plans or grandfathered plans under the Affordable Care Act. I intend this to be, while an excellent and momentous occasion, a stepping off point to try to get back next year and get autism coverage declared an essential health benefit in Kansas under the Affordable Care Act, so that it can be extended to the families of all 8,400 Kansas kids with autism. That's what we're going to work for.